One of the things about medication in treatment is that a lot of people are afraid that if they go get help from a counselor, if they seek help from a counselor, if they take their child to a counselor, that they're just going to put them on medication. There are a lot of diagnoses that do not need medication, so it's a legitimate fear. We see it more because of a lot of the medications that are advertised on TV. And so, first I want to address a little bit about the fear of medication that, depends on the counselor you go to. If you go to a counselor who is, say, a licensed professional counselor, a licensed marriage and family therapist, a psychologist, those are counselors. They will do talk therapy with you, different kinds of talk therapy. They can't prescribe medications. The counselors that prescribe medications are psychiatrists. That is the only kind of doctor who is also a therapist that can prescribe medications. Then your general practitioner, your actual MDs can prescribe medication. A counselor can work with you and do talk therapy and recommend that you see a doctor for a medication evaluation if they think that you will benefit from medication as part of your treatment program. If you have depression, anxiety, any kind of disorder that will benefit from medication being a part of the treatment. The mass marketing of medication in the last few years that we've seen, it has a lot of benefits. It also has a lot of concerns. On the one hand, it has certainly helped to decrease some stigma around medication because it's provided education. People can actually see medication names and look them up and do research and find out what is that medication used for. They have access to information in a way that they didn't before. And that's a great thing. People should know what they're taking and they should know about different treatment options. Some of the concerns are that sometimes people will see ads and they will think, maybe I have that and kind of get scared and self-diagnose and have access to a doctor who perhaps would give them a medication that maybe it's not right for them. Maybe they need to be having talk therapy as well as a medication, or maybe they don't need that medication at all. So it's really important to not jump to conclusions with medications because of the information you've seen on TV. Another thing that is sometimes problematic with the mass marketing of medication is the idea that, perhaps this pill is really all I need. While medication is helpful and is absolutely necessary for certain diagnoses, it's not a cure. It's not going to make a mental health diagnosis better all by itself. Talk therapy, behavioral programs, all kinds of things work with medication to bring about change in situations. So it's important that people receive education about medication as part of treatment. It's also really, really important that therapists work with doctors who are prescribing. A team approach is really, really important for the overall quality care of a patient. If you're doing counseling and they recommend that you see a doctor for a medication evaluation and they put you on medication, it's really important that you give that therapist consent to speak to your doctor. Now, your therapist can't speak to anyone without your consent, so it's really important that you authorize them to be able to talk to your doctor and your doctor to be able to talk to them so they can give feedback and say, here's how they're doing in treatment, and vice versa. The doctor can ask questions because that way you get the best evaluation and you make sure the medicine's working, or if the medicine's not working, they can adjust. The doctor will also rely on your report as a patient, but the overall care is really important that they know what's happening. And that's going to make it more effective treatment for you to have the counseling and the medication working together.